On Hot Copy this morning, the World Health Organization has yet to declare an international public health emergency on the new coronavirus. This after officials said they need more time to study the situation and take a closer look at its global impact. WHO's emergency meeting on the new coronavirus will resume tomorrow. And we're honored to have with us in the studio this morning Dr. Rabi Abiyang-Singhe. He is the World Health Organization's representative to the Philippines. Dr. Ravi, thank you so much for coming to Head Start. What a pleasure to have you here and an honor. So right now there's a discussion within the World Health Organization to declare or not to declare an international public health emergency. Why not just declare?
Karen, to be very clear, as our Director General clarified last evening, in fact, in the early hours of this morning, Philippine time, the decision to classify an outbreak as a public health emergency of international concern is a very serious one. It needs a thorough review of the evidence that is available, an assessment of the risk, and that discussion started last evening with the convening of the committee looking at this. So this committee is a committee of experts, global experts. They were discussing the pros and the cons for declaring this event a public health emergency of international concern. And last evening's deliberations were inconclusive. So what we have been informed by the chair of the committee, Professor Hussein from France, and our DG, is that the committee will reconvene today. That's today evening Philippine time. And
all right,
we are expecting some conclusion later today.
Yeah. Dr. Ravi, there are already 17 dead in China. A viewer might be wondering, what elements would you need, or does the WHO need, to actually declare it to be an international public health emergency?
So let's just clarify, 17 dead of how many people infected. That shows how serious this disease is, right? And until the earliest evidence of the outbreak was detected only on the 31st of December. Today is the 23rd of January. In this short 3 weeks of time, the Chinese authorities have identified this new coronavirus, what we call the 2019 novel coronavirus. They have sequenced the genetic sequence of the virus, and that has helped develop testing kits that will help determine whether somebody is infected or not. The issue is that the virus actually causes a respiratory infection, and this being the flu season, there's many people who have those signs and symptoms. So to determine if somebody is actually infected with this virus, you need a definitive test, as we've seen in the case of the child that was detected in Cebu in the Philippines. So now we have this test, and now they're testing increasing numbers of people. Last afternoon it was 446, I believe. Now unofficially I'm hearing that it's over 500. Similarly, the number of deaths were reported to us officially as 9 at midday yesterday. We understand now the media is reporting that it's at 17. So how severe is the disease? It depends on how many people affected by the disease are actually succumbing to the disease. If you look at the profile of the 9 people that had died by last afternoon, many of those people had pre-existing health conditions that actually contributed to a worsening of the severity of the disease. We are not clear of the new deaths that have been unofficially reported. So WHO is working with the authorities in China to better understand whether this virus per se is causing death in otherwise healthy people, or it's more likely that it's causing death in people that have pre-existing medical conditions.
Okay, if the 2019 coronavirus is causing death, hypothetically in healthy people, would you consider that as an international public health emergency?
Again, it would depend on the proportion, the mortality rate, what we call. how many people getting infected, what percentage would be dying. So many diseases have mortalities, and that proportion of people dying is pretty low, and we don't declare everything a public health emergency of international concern.
So let's discuss what we know so far. The 2019 coronavirus, if you read different reports, some will say it's weaker than the SARS, and yet some say there's not enough information, it's mysterious, it could be stronger. What does the World Health Organization know? Is this virus, this new strain, deadlier than the first one?
Well, what we need to look at it from is that the world, and particularly this region, is better prepared for an outbreak of this type following the outbreak of SARS.
But is it deadlier than SARS?
So I'm coming there.
Okay.
Right? So because of that increased preparedness, we are ready to handle it better. The information about the disease, the reports came out much earlier. The isolation of the pathogen has happened much earlier, and so there is more access to information now. But if you look at, it doesn't seem that it's deadlier than SARS. Of course, this is very early assessment. As I mentioned earlier, there's quite a few things that we are trying to better understand about these diseases. But the early indications are that out of about 500 or more people that now reported to have been infected, it's not causing a significant proportion of deaths, right? It doesn't point to say that it's more deadly. Of course, that's a premature conclusion at this point of time. But based on currently available evidence, what is clear is that we are better prepared as a region, as countries, to deal with an outbreak of this type. And maybe that's also resulting in less deaths.
Okay. A doctor from the University of Hong Kong said that what we know is, yes, it doesn't respond to antibiotic treatment, but the 2019 coronavirus causes pneumonia.
Yes.
It sounds quite alarming.
So the novel 2019 coronavirus is not the only virus that causes a pneumonia, right? We also need to realize that we don't have antibiotics against viruses. Antibiotics are usually used against bacterial infections.
Yes.
Viral infections, we have antiviral drugs that can be used. But in the case of the coronaviruses, we don't have specific treatments yet. So what we do have, and what we have tried and tested, both during the SARS outbreak and in the MERS-CoV outbreak, which were both coronavirus infections, was that if you institute proper care and supportive management, you can end up with a good outcome. And that's what we are now encouraging. So WHO has come out with interim guidelines on patient management based on what is known now. This is of course being updated almost daily, but that's what we know now, and that's the guidelines that we've shared with countries.
What are these guidelines, sir?
The guidelines are for management of patients largely in a way similar to the management of a SARS case.
Which is?
Which is supportive treatment, rest,
Yeah.
Facilitating breathing if there's breathing difficulties, what clinicians would normally do with a patient with acute respiratory syndrome.
So, you know, it's flu-like symptoms, but then clearly it's not the flu. So how would I know if I had coronavirus?
So at this point of time, we have to depend largely on your travel history and exposure to possible known cases. As in the case of the Philippines, many countries are just setting up systems and tests in their laboratories to test for the presence of this virus. It's a new test because the tests were developed after the 10th of January. We have formally received a request from the Department of Health of the Philippines that we are working on to source the material necessary for the Research Institute of Tropical Medicine to have that capacity. They have the basic capacity. That's how they confirm that the child in Cebu had a coronavirus. But whether it's this particular one, you need to do further tests. And that's what we are helping them with.
Okay, but for a regular parent who, may not understand technical terms, how would they know if their child has more than just the flu? I mean, with the coronavirus, hypothetically, like dengue, you'd have spikes of a high fever spike. With the new strain, what do you have? Are you coughing more? Do you have a hard time breathing? Do you have high fever?
So the clinical spectrum of the disease is just now being understood. From the latest evidence that is emerging yesterday, there appears to be many cases with mild disease. But certainly some of them are progressing to severe pneumonias. So the spectrum of the disease dictates that you could have just respiratory infection with a mild fever. You could have a severe infection. We are working to better understand what proportions are involved in this, who is more at risk. So at this point of time, our interim guidance says those people at the extremes of age, those people suffering from pre-existing conditions need to be more careful.
But wouldn't this be then more deadly than the SARS, for example?
Certainly,
I mean, if you think about it, I'm just curious. I know you need more information, but think about it. If what you're saying is those who have passed away of pre-existing conditions, it's almost, it's almost like if you're not strong enough, it could kill you, in layman's terms, right? If you're old enough, it can kill you. It would seem that way if you're weak, it can kill you.
not necessarily.
Okay.
If you look at the data that the Chinese authorities have shared coming out of Wuhan, and even some of the other cases that have been detected internationally, many of them have recovered from those symptoms, right? We've not had any deaths outside of China at this point of time. Even in the other provinces of China, we believe up till last afternoon they had confirmed infection in about 14 Chinese provinces outside of Wuhan, but they've not reported any deaths.
Okay.
So
Now, a vaccine is being developed against the coronavirus. Based on your experience, will this work? I mean, do vaccines work considering that new strains develop all the time? This was the controversy, frankly, with dengue.
So let's be very clear. It's very unlikely that we are going to have a vaccine that is effective against all coronaviruses, right? We are working with the global community of researchers. They are still trying to develop a vaccine for MERS-CoV, right? We still don't have a
Yes.
product. Some products are being tried out. We don't have a vaccine for SARS. It looks like the vaccine would be a very easy solution and a fit and a very reassuring product to have, but we haven't so far succeeded.
Yeah.
Right?
No, just to update the viewer, what you're saying is the vaccine that's being developed was technically for the MERS virus that came out of the Middle East in 2012.
Yes.
So that's a different, it's in the coronavirus family, but the vaccine being developed is to solve that one.
Yeah.
But not the 2019 strain.
Eventually people will start working on this, but this is very early, right?
How different is the strain? You did share with us that there's a new genetic pattern. But when these viruses mutate, how different? Is the mutation to the point that they don't recognize each other?
We certainly can. I'm not a virologist. I cannot
Yeah.
comment on how the viruses
Yes.
behave. And we don't know that this virus is mutating from another virus. It may well be that this coronavirus was a long existing virus in some zoonotic animal, right?
Okay. Yeah.
And it has probably more recently acquired the capacity for some unknown reason to infect humans.
Yeah.
The what we know is that previously this virus has not been confirmed or reported even in any animal,
Yeah.
right?
Now,
As far as we know.
Yeah.
So it's very difficult at this point to clarify and say this is a new coronavirus. Well, it's certainly a new coronavirus that infects humans. That we know. But the history of the virus, we don't know.
yeah, they've determined that more likely the source is animals from the market, sold in the market. Do you agree with that?
Well, based on the fact that both SARS and MERS had origins from animals, it would may be safe to assume that the 2019 novel coronavirus was also linked to an animal product, because the factors pointing in that direction is the fact that the initial outbreak in Wuhan was concentrated around that seafood market, where although they call it a seafood market, there was a lot of other meats being sold.
Yeah.
So
So they don't know which animal yet.
we don't know.
Now, the way humans, animals live together and the way we conduct our lifestyle, this is not the first time that a virus has been sourced from an animal.
Yeah.
Except there have been many times when the animals do have a virus, for example, with pigs. It stays just with pigs and it does not transfer to humans, right?
Yeah.
But what's deadly is when it's a virus from an animal and it moves to a human.
Yeah.
It can kill in the future, if not managed well, thousands of people. It's almost like the plague in another form. Doctor, is the World Health Organization studying ways on how we interact, we do business, on how this won't happen on a bigger scale?
We are certainly the lessons learned from the SARS outbreak and the MERS outbreak are on those lines. That's why I said we have now a better prepared region, a better prepared world to deal with this kind of situation. But some of these viruses are coming from exotic meats, which are not what we normally
Yeah.
consume, right?
What is an exotic meat? Can you give some examples? What would you consider exotic meat?
So the MERS-CoV virus was in camels,
Camels.
camel
okay.
milk, right?
Yes. Camel meat.
Milk.
Milk. Oh,
Yeah,
camel
but
milk.
the virus is in the camel and it tend to infect people who consumed the dominated camel's milk.
Okay. The milk.
But and also who were working very closely with camels.
Yeah.
But and if you look at the SARS virus also, the information is that it had a history of being in civet cats or other animals.
Cats.
Yeah. So
Wow.
and that at some stage it through a stage in bats it acquired some ability. So the viruses are shared among different animals, and sometimes they cause disease in animals, sometimes they don't. But eventually some of those viruses, and I'm talking of coronaviruses now, acquire the ability to infect humans and actually cause disease in humans.
Yes.
And that's what we are seeing now. The fact that a virus from contaminated meat can infect a human because of consumption of contaminated meat, that is potential for limited transmission. The problem becomes more severe when that virus also acquires the ability to transmit from that human to another human without consumption of meat being involved. What we are talking is possible sustained human transmission, right? So basically what has happened is the virus has acquired an ability to move from one human to another human. Now if you look at the data here of what we are dealing with, the initial picture pointed to possible infection among very close contacts. So people were trying to determine did they consume some meat that was infected and sold at the Wuhan market,
Yeah.
right? But now it appears that that's not the only case, because now we are seeing cases that have been confirmed among health workers who were looking after the sick, right, in Wuhan. So this is pointing to the fact that there is some human to human transmission
Of the new coronavirus.
of the new coronavirus. That's why we are now seeing approximately 450, 500 cases. So all of these people, and among them, some of them have not been to the Wuhan market. So it's pointing to the fact that this virus has some capacity to go from human to human.
By air, not touch.
It's usually in body fluid, so it's probably droplets because it's a respiratory infection.
Okay.
It could be saliva. It depends on what degree of contact you've had with an infected person. That's also why we are advocating the measures we are advocating to protect people.
While you put it in all other spectrum, the Department of Health said that it would help not to enter crowded places and wear masks.
Yes.
But that, I mean, it almost gives you a sense of panic. You know what I mean?
No, but it's more important, I think, to also emphasize that because this is flu season and people who have signs of respiratory infections, even if it's a common cold, should practice some degree of social etiquette, distancing, avoid crowded places, so that they minimize the risk of infecting other people. So it's not only about healthy people trying to protect themselves, but the onus is also on people exhibiting signs of a respiratory infection, because we don't know what we are dealing with, to have caution, because this is not a normal flu season. This is a normal flu season when we have a new respiratory pathogen that is going around and we are trying to understand. So the onus is on people who have symptoms also to be more careful, to practice cough etiquette, to use a handkerchief, wear a mask themselves, so that other people are not infected.
Okay. Now, I'm taking from you certain points. The social etiquette is one thing, but there's another point. This might be controversial. Is the world telling us in a way to already lessen eating meat? I mean, I just want to ask you, I mean, I know it might be hard for you being part of the World Health Organization, but you've mentioned what caught me, what you said. These viruses, most of them have come from exotic meats. So the animal has a virus, he can handle it, or she, they pass it among themselves until, let's say, you eat the meat, you drink the milk, and then the human gets sick.
Yeah.
Is this a message for all of us that, number one, eat more vegetables, less meat, or number two, trust only farmed meat?
You can push it anyway, and farm meat is not to say that. What is important, I think, in this is to properly cook your meat, to properly process your milk, boil your milk, because simply processing or boiling your milk or cooking your meat well would ensure that the viruses are all destroyed, right?
So let's say in the camel milk, in the MERS, in the MERS virus, because that's also under the coronavirus family, are you saying if the camel milk was boiled properly, the virus could have died?
Certainly. Not could have, would have died.
Would have died.
The infection was caused because people were drinking raw camel milk without boiling it.
Thank you for that clarification. Say they were drinking it raw.
Yeah, without boiling it. That was it.
So properly cooking your meat.
Yeah,
now,
especially, I mean, people like to eat exotic meats, right?
Yeah.
But it's even critically important that if you're consuming exotic meats, that you ensure that it's properly cooked, right? That you don't eat it rare or medium rare.
So would you recommend, I mean, this might be another controversial question for you, because it might affect a major industry, but you did say that in Wuhan, it could have come from seafood.
I didn't. We don't know.
You don't know yet, but...
We don't know whether it came from seafood or from animal meat.
Okay.
The only thing we know is that the outbreak was concentrated around the so-called seafood market, right? It's not an exclusive seafood market. That's
But
the issue.
it's part, well, there's seafood there.
Yeah. So we don't know the
So,
source.
would you advise then? I mean, what about eating raw fish? I mean, people eat sushi, sashimi. This is gonna be.
Yeah, but
Where does the WHO stand on this?
our position is that we have as yet not identified a coronavirus from seafood, right? And we respect the cultural practices of people. So we cannot say cook your sushi, right?
Then it wouldn't be sushi.
Yeah.
Exactly.
So
Okay.
we respect the cultural practices, but and we have no evidence at this point of time to say cook seafood because we haven't isolated the virus, any coronavirus from seafood that infects humans.
Yeah. But Dr. Ravi, it's already been more than a week. Why isn't it that, I mean, why hasn't either the WHO or even Chinese health officials, why haven't they determined the source? Wouldn't there be a way, for example, to check the animals? Is there a way to do that?
So let's try to understand that maybe the animal meat that was sold was contaminated, but they don't know where that exotic meat was sourced from, right? Because this is not, sometimes this is not even legal, right? The meats that are traded, because it's wild meats sometimes. So you can't go back and check, right?
Yeah.
But if you check normal livestock that is farmed, they're probably negative, right?
Yeah.
So this is the challenge that we are dealing with.
Yeah. For a regular person, a mother who's watching right now, if the child has flu-like symptoms or anyone in their family, where do they take them? Can they take them to any hospital? Would any hospital in the Philippines, would they have what they call, is this correct, a pan-coronavirus test? Is that how you conduct the test?
So the pan-coronavirus test is available with the Research Institute of Tropical Medicine.
Only?
Yeah, as far as I know. And they have their subnational laboratories. But it's critically important to understand that everybody who has flu-like symptoms doesn't need to be tested for coronavirus at this point of time, right? What is more important is to understand the epidemiological context. Was that person, or did that person have a travel history, including travel to Wuhan sometime after December, right? Did that person have close contact with a known coronavirus infected patient?
Yeah. But what if you don't know the person you were talking to has it?
Well, right now the numbers are very small. They are largely concentrated in China, right? Do you have travel history coming from China? So we are now broadening if you're looking at a risk analysis, right? But without that evidence, there is no need to unnecessarily get anxious and ask for coronavirus tests for everybody who is exhibiting respiratory symptoms.
China has already instructed and is conducting what they call a transportation lockdown in Wuhan.
Yes.
What would the best standard operating procedure be in terms of welcoming or accepting people who have come from Wuhan? The flight attendant, I mean, did it right that she self-exiled herself because she flew from Wuhan.
Yeah. So this is exactly what we are pointing
Yeah.
to, that if you have had any travel history recently to Wuhan and you start exhibiting respiratory symptoms, and it may have been 2 days ago, it may have been 2 weeks ago, right? Or it may have been 1 month ago.
Yeah.
But if you've been to Wuhan and you suddenly start exhibiting respiratory symptoms, you need to inform your clinicians.
Yeah.
Because we are dealing with a disease where we don't know the incubation period. So it may be that
But
the
would
disease...
would you know the incubation period of the past coronavirus or no?
Yeah, now I think they have that information. But for this particular new coronavirus, we don't have that information, right? For the previous ones, it's about 14 days. Right.
2 weeks. 2
Yeah.
weeks.
In this case, we don't know what we are dealing with, right? So, what we are saying is if you have a travel history to Wuhan, particularly since December, you need to make your physician aware of that fact if you are having respiratory symptoms. Then they will
Okay.
initiate the process necessary.
Yeah. I know you're resuming your meeting tomorrow. What are you expecting to achieve in these talks tomorrow?
So, the decision to announce a public health emergency of international concern is a very careful decision that the organization makes, and this is under the provisions of the international health regulations. This provides for a coordinated response across member states, across international borders, to address a severe public health threat,
Yeah.
right? So, that gives provision for the organization to ask member states to implement certain restrictions. So, but that needs to be very carefully evaluated.
Yeah.
That's the seriousness of the issue, because all of these decisions are directly tied to people's livelihoods, and so we need to take a careful risk assessment before such a decision is made.
Okay. We have a viewer asking right now. It's Dimitra Nasser is asking, can travelers bring it to the Philippines unknowingly and undetected by a screening device?
There's no way that a screening device can tell you that you're carrying the virus, right? This is also why we have been hesitating about putting travel restrictions, because even the thermal scanners at entry points will detect if your body temperature is high or low, right? And your body temperature can be controlled just because you took some antipyretics, right? So we know that they are not terribly effective. And the even more important is you may not be having clinical symptoms at the time you are traveling, right? So screening devices will not pick it up. So what's important is for you to be honest with your clinician about your travel history, so that they can make a assessment and act accordingly.
Okay. On that note, Dr. Rabi, I want to thank you so much for
Thank
coming
you.
to Head Start. Thank you. That was Dr. Rabi Abeyang Singhia, the World Health Organization's representative to the Philippines.